Then we should start. Hello, everyone. Thank you for joining with us today. So today we have two speakers. We have Dr. Kyle Kopko, who will be starting us over. So Kyle is an executive director of the Center for Rural Pennsylvania. He joined the institution in 2020. Before joining the institute, he has served as the associate dean for institutional effectiveness, research, and planning, an associate professor of political science in Elizabethtown College. And then we will also have Dr. Lisa Davis, who is an associate professor with Penn State Health Policy and Administration. She also serves as the director of Pennsylvania Office of Rural Health, where she oversees the strategic development and implementation of the unit. So before we start, I wanted to remind everyone that the Zoom session today will be recorded. So when you're entering the session, you'll be automatically muted. But the speakers have agreed that if you have a question, just to unmute yourself and ask during the presentation. But I will also keep an eye on the chat window if you have questions. For the registered participants after the talk, we will share the slides as well as the link to the presentation. Kyle, without further ado, take it away. I will stop sharing my screen so that you can share yours.
All right. Well, thanks so much for having me this afternoon. And I'm really glad to be here with my good friend and colleague, Lisa Davis. So we really enjoyed talking about some of these big macro issues that are facing our rural communities across Pennsylvania. And please feel free to speak up if you do have a question along the way. And we can also make these slides available after today's Zoom webinar. So I'm going to start off here by sharing. Let's see if this will work for me again. 1 second. All right, is that coming across for everyone? Great.
Yeah.
Well, thanks again, everyone. And for those of you who haven't been on one of these webinars before and haven't had the opportunity to learn about the Center for Rural Pennsylvania, I'll give you a quick background. We're a legislative agency of the Pennsylvania General Assembly, so the legislature down in Harrisburg. And we're essentially a think tank that serves both the House and the Senate in a bipartisan manner. And we have two broad mandates. One is to administer a grants program, and we do that by providing grants to faculty members at state universities. So Penn State faculty, check out our website. Rural health issues is something we're keenly interested in, and also our RFP is live right now for 2025. So feel free to visit our website and learn more about our grants program there. And then we also maintain a statistical database on a wide variety of indicators. And in practice, what we do is we track both rural and urban, so we can do a comparative analysis. This isn't just for the Pennsylvania General Assembly. We do this for researchers such as yourselves. We do this for municipal officials, county officials, school directors, nonprofit leaders, business folks, anyone who has an interest in rural conditions. And in addition to all that, we also host legislative hearings on a wide variety of issues. Our most recent hearing focused on childcare access, or the lack thereof, I should say, in rural areas and the implications of that. And our website, rural.pa.gov, contains a lot of different information. So there's data on our website, but also any of our past research reports, either authored by our faculty colleagues and collaborators, or reports that we have authored in-house. All those are freely available on our website. And you can see a sample here of some of our most recent and forthcoming reports. Our population projection report is featured here on this slide. And I'll be getting into that a good bit more. And I think that that's really the big overarching idea, is our changing population, which is going to have a wide variety of healthcare issues and implications, and particularly related to the workforce of our healthcare industry. And just to set the stage of what we're talking about here, what is rural? So there's a lot of different definitions out there, and a lot really depends too on which government agency you're interacting with. But within the Center for Rural Pennsylvania, it's a binary definition. You're either rural or urban. Here's the county definition. It's based on population density. If you're below the average density statewide, you're considered rural. If you're at or above that threshold, you're considered urban. And you can see here about 3/4 of Pennsylvania's land mass is considered rural by the county definition. And one of my favorite factoids, I never get tired of saying this, but if you were to take rural Pennsylvania and make it its own state, it would have a population greater than 21 states and the District of Columbia. So when we're talking about policy issues, it's really like operating with a state in a state. So it gets to be complicated. There's geographic variation, I'm sure, as everyone here is well aware of, but you can see here a lot going on in rural Pennsylvania. So here are the 5 big takeaways I want to discuss for this afternoon's presentation. We are growing, we think. I'll get back to that in a moment, but very slowly. The population change throughout Pennsylvania is not uniform. There are different pockets all throughout Pennsylvania, so we really need to be cognizant of this. Some are increasing, some are decreasing. Due to natural population change, we're unlikely to grow on our own, and I'll discuss what that means too. We're also becoming older and more diverse, and all these considerations will have a lot of wide-ranging impacts for policy. So let's talk about population change. So I mentioned that we did release some population estimates. We did this in conjunction with the State Data Center at Penn State Harrisburg. They've been longtime partners in forecasting population change over time. And you can see what's happened to Pennsylvania's population overall. I'll get my laser pointer here so you can see. In the 1920s, we were just over 8 million people statewide. Increases, but now it's plateauing based on our projection. So we're going to be around the 13 million mark for the next few decades. And you can see here, this isn't exclusively a Pennsylvania phenomenon. The rate of change, even across the nation, is declining. So you can see our rate of growth is going down for Pennsylvania, but also nationally. So a lot of the trends that I'm talking about here today, they're going to be the most acute in our rural communities, but they also have applicability to our state population and also our regional population. So I think a lot of the things that we're seeing in the data aren't unique to just us. It's really the Northeast and even the Appalachian region. So just keep that in mind. So here, we'll talk about the uneven population change that we've been seeing in Pennsylvania. And this is just the window between the 2010 and 2020 census. So any of the green shaded municipalities here grew. They had population growth, but any of the white shaded municipalities, population stagnation or decline. We grew at a rate of 2.4% over that 10-year period, but for many rural communities, there was a decline. And you can see where this is largely happening. In the upper left here, this red line, that's I-81 and I-78. So largely speaking, if you're to the south or to the east of those highways, again, generally speaking, you're seeing population growth. Now, there's some exceptions to that. For example, Center County, home of State College, there has been population growth there because of the effect of the university and some other factors. But by and large, that's where we're seeing most of the growth in Pennsylvania. And you can see here how this bears out in the data. So this light green line is the Southeast, not just Philadelphia, but pretty much all these counties here. That has been increasing and projected to increase over time, whereas in other parts of Pennsylvania, it's slightly declining. Now, again, this isn't something that's unique to Pennsylvania per se. You can see here a lot of these white shaded counties across the United States also had population decline. And again, many rural communities, about 2/3 of rural counties across the United States had population decline over that 10-year period. Excuse me, I wanted to share the projected changes out through 2050. Now, obviously, we're talking about a 30-year period here. There's going to be larger confidence intervals the longer you go out. But what we're projecting in cooperation with our partners at the data center, we're only going to see 1.6% growth over 30 years. So think back, we had 2.4% growth between 2010 and 2020. But for 30 years, just 1.6%. So we're showing or expecting a pretty significant slowdown. And a lot of the places where we're expected to see growth, again, in the Southeast, places like Center County, again, significant anchor institutions there. Same thing with Union County, which is why that's showing up so much. You have Bucknell, a number of federal prisons too. So keep that in mind. Now, I want to back up and just talk about some of our most recent census estimates. I'm going to show you another map now. So this is our projections out through 2050, showing 1.6% growth. Here's what the U.S. Census Bureau has shown just in the last 3 years. So the estimates with the state data center were largely based on pre-COVID migration patterns. And post-COVID, we've seen some more growth, particularly in the Northeast, that wouldn't have been as accurately captured in those projections. But here's where it gets to be a little troubling. Just within the past 3 years, the Census Bureau is projecting that we're already down statewide 0.3% of our population. So the estimates that we had forecasted showed very slight growth. But if we're heading in the direction that the U.S. Census Bureau thinks we're heading, our long-term forecast could be much more rosy, unfortunately, than what we're anticipating. So this is something that we're keeping a very close eye on because, again, it affects a wide range of policies. This is your workforce. This is your tax base. This will affect representation in Congress, access to federal dollars, so on and so forth. All right, to that end, we're really unlikely to grow our own in terms of our population. And what you can see here is the number of births and deaths in Pennsylvania since 1990. Steadily over time, the number of deaths have been going up, the number of births have been going down, and obviously we had a sharp uptick in deaths due to the COVID-19 pandemic. But even whenever you're adjusting for this, you can see these lines were heading in the direction of convergence to begin with. We're simply having smaller families, and then that's combined with having a larger, older generational cohort in the baby boomers, and we can get to that a little bit more. Again, this is not strictly a rural issue that we're seeing in Pennsylvania. It's really something that affects a wide range of communities. But any of these shaded counties had more deaths than births over the last census period, 2010 to 2019. So that is really the major driver of our population. And you can see here, based on fertility rates pre-COVID, there were only 3 counties in all of Pennsylvania that hit that 2.1 replacement rate. And we're just not doing that nationally either. So we're having smaller families, fewer babies, and that's going to affect, how our population in Pennsylvania and the rest of the country grows over time. And to further emphasize this, so you have 2 components of population change, really. Natural change, births and deaths, and then other types of non-natural change due to migration patterns, which is due to a wide variety of considerations, probably economic for the most part, or maybe there's a family connection or something to that effect. But you can see here, this is what's interesting. Pennsylvania actually had positive net migration. So good for us. That's a really good thing during this period of time between 2020 and 2022. And you can even see there's a fair number of rural counties in this map here. Any of the shaded ones had positive net migration. So there's a conscious choice, it seems, by some individuals to relocate into Pennsylvania and our rural communities altogether. But again, the births and deaths imbalance is really driving a lot of this. And something else I wanted to point out, who these individuals are who are coming into Pennsylvania and our communities. If it weren't for international migration, If it weren't for these 34,564 individuals that the Census Bureau has identified, our net migration would have been negative. So among those who are already in Pennsylvania in the United States, net migration out of Pennsylvania, it was negative. So that's how we got our net positive. It was largely due to this influx of international residents coming into Pennsylvania. So we are going to become a bit more diverse in that regard too over time. So I like to point that out because also in terms of healthcare access, if individuals are from another country, they have different dialect needs. Obviously, this is also going to relate to educational needs for children in the household. I think this raises a host of other questions about how do communities meet the needs for this population. And I think it's probably going to be in a similar trajectory for some years to come. So emphasizing again that we are becoming older based upon our projections from the data center here. So 20, 30, 40, and 50. Right now, we are converging between the number of old people, senior citizens, and young people. I didn't mean to say that in a bad manner or anything like that, but 65 years of age or older. And of course, this is all being recorded. So you can see here our breakdown of those individuals who are 65 years of age or older and those under 20. Okay, green line is those under 20, silver line, those 65 years of age or older. As of the last census, we're already at 26 counties that had more older residents than younger residents. And by the end of this decade, the majority of Pennsylvania counties are going to be like that. 53, we're going to be at 56 counties by 2040, and then it's going to decrease in 2050. And not to be morbid, but it's because they're not going to exist in all likelihood. And you can see the generational cohorts here. The baby boomers make up a very sizable portion of our population overall. Gen Z is actually the largest, but part of the reason is that we haven't really established an end cut point for the Gen Z folks. And you can see what's happening, the number of them declining because fertility rates are down, smaller families, et cetera, et cetera. So once the baby boomers and the silent generation, the greatest generation, start to age out, there's not going to be as many individuals coming after them. And also you can see in terms of diversity, I was talking about this in the context of our international residents, we're seeing a steady increase over time. The percentage of population in Pennsylvania and the country, the United States overall, that is people of color. And to put a finer point on this, if we look at the census data from 2000 and compare it to 2020, we went from 1.9 million people of color in 2000, 3.4 million in 2020. So we're not going to ever have a lot of dots in here because that's an Allegheny National Forest and you just can't build there, obviously. But you can see in rural areas and urban areas, we are becoming more diverse. Each one of these dots represents 10 people. So we are growing in that regard. So what are some of the implications? One of them, school district enrollments. We're going to have fewer and fewer school children in our K through 12 system. Any of the school districts up here are projected to have an increase if they're shaded in green. But overall, we're looking at almost a 7% decline in the number of school-age children by the 2032-2033 academic year. And also, what does this mean for things like labor force? And I know Lisa's going to get into this a bit more too, but our statewide participation rate is under half. Now, this includes children, this includes senior citizens. So if you take all population together and look at who's in the labor force, on average, we're just below that 50% threshold. Any of the green shaded counties are above that statewide rate. Any of the silver colored ones, largely in our rural areas, are below that statewide rate. And you can see how this plays out over time, where in rural, it's largely declining over time. It's declining too in urban, but there's more of a sharper decrease in our rural communities. And to put a finer point on this, you can see what's happening to our age cohorts. This is based on first quarter employment data dating back to the year 2000. So back in 2000, we had maybe 750,000 individuals who were in this 55 years of age range. Fast forward to 2023, it's essentially doubled. So we are going to have an older workforce overall. And I think that raises a lot of different implications about preparing for the future. How many individuals are we going to have to replace in a wide range of professions? And also, as individuals continue to work, what types of accommodations will they need in order to keep working at an older age? So those are all some pretty big policy topics to consider. So in summary, I just wanted to wrap up and restate a few of the big key takeaway points. We're really in this period of population stagnation, and it's definitely a long-term trend. This isn't something that obviously happened overnight, and we are becoming an older and more diverse population, not unlike many of our other states. So I didn't have this in our slide deck, but our neighbor to the west, Ohio, they're looking at almost a 6% decline statewide by 2050 based on their statewide estimates. We don't have good data for West Virginia, but the Western Interstate Commission on Higher Education likes to forecast the number of high school grads, mainly for college admissions purposes. And their last estimates indicated that by 2037, between 2019 and 2037, West Virginia would have a decline of 24% of their high school grads. It's not that people aren't graduating high school, that they're not making academic benchmarks or anything of that sort. They're just not there. There are fewer young people. So again, I really want to emphasize that this is a regional statistical trend, and Pennsylvania certainly is not alone in that regard. So I know I threw out a lot of data there, but hopefully that's some interesting food for thought. And I'm going to stop sharing my screen, and I'll turn it over to my colleague Lisa, unless if there's some other questions that anyone has a really burning need for clarification.
All right. Well, while you all are thinking about questions for Kyle, I will go ahead and get started. Really glad to have heard from my former really good colleague, Kyle, who just called me an old person, even though I got to celebrate my very important birthday with the center staff, and they sang happy birthday to me. So thanks, Kyle.
I knew I was going to get zinged on that one. It was
I can't help it. I'm sorry.
I know.
I'm sorry.
Well, I put in my mouth. It's okay.
No,
it's not the first time.
So it is so all right. So I'm going to go ahead and share my screen with you all. But while I'm bringing this up, I do want to say that truly, and I mean this most sincerely, that if you are interested in any sort of data, especially broken out over rural and urban areas, the Center for Rural Pennsylvania is absolutely the place to go. I go to them for all of my data and find that not only do they do a great job of providing me with the data that I need, broken out over rural and urban, but they also ask additional questions, and it adds significant value. So please be sure and reach out to them, because they're a tremendous resource. So what I'm going to be talking about is the connection between population change, the economy, and rural health. And very quickly, some of you may already know who we are at the Pennsylvania Office of Rural Health, and I appreciated the nice introduction. We're one of 50 state offices of rural health across the country. We're one of 10 that are university-based. All the rest are in state departments of health, or there are 3 that are 501c3s. We are federally mandated to be a source of coordination, technical assistance, and networking to support initiatives, activities, clinical training programs, essentially anybody in our state as well as nationally who is focused on increasing access to healthcare services in rural areas and increasing the health status of rural residents. And we are focused on a number of things. We run a couple of small rural hospital programs. We have a focus on population health, quality improvement, healthcare transformation, and so on. And we also, I just want to make a note here that rural human trafficking is something that we have been focused on for the last 8 years or so. And so I would, if you have an interest in that, please get in touch with me. And so I'll move into the actual content here. Rural health is really an economic driver. In any community, and especially in rural communities, there are 3 top employers: education, government, and healthcare. And depending upon the county and depending upon what is available in that county, healthcare very often tops out at the top. And that's what we're going to be talking about today, obviously. So here are some facts about healthcare costs, and I think that you all know this, but just to reiterate that we spend an enormous amount of money in the United States on healthcare, and that it quadrupled from 1980 to 2018, and in 2022, it was 17.3% of the gross domestic product. And most of these services are in hospitals and professional services. And I think especially for some of the work that our office does and what you may be doing is that healthcare expenditures are quite variable. And they also tend to be the highest for those who are the youngest, those who are the oldest, and those who have the poorest health. And you may all looking at fact 4, you may all remember maybe about 8 years ago, 10 years ago, I guess, there was a study that was done looking at, I think it was Dallas, Texas, and the amount that was charged for healthcare services in that area of Dallas versus other areas across the country, and it was twice as much. So healthcare costs do vary across the country for the same service. And as you also know, the US pays more for healthcare services than other advanced economies, and administrative costs are likely the highest. And we have a really tight physician labor supply, as well as looking at changes and challenges with nursing supply. And that will feed into when we start talking about specific types of services. So let's talk for a minute about health planning in Pennsylvania. Many states use something called a certificate of need. Pennsylvania had a certificate of need process which sunset on December 31st in 1996. And what that means with a certificate of need is that if a healthcare provider or an organization or essentially anybody wants to open up a hospital, an acute care facility, a nursing home, a personal care home, an outpatient a surgery center, they need to make sure that they are being able to determine the need for that service in that community. What is the population? What are the needs of those populations? How many other services are like that? When the certificate of need sunset at the end of December, it was replaced by something called the State Health Improvement Plan, or SHIP, and the State Health Assessment, otherwise known as the SHA. And so with that, it really left health planning up to healthcare systems. In theory, it was supposed to be communities. But what we have seen since SHIP came into place in 2000, which was when the first State Health Improvement Plan was published, we have seen a wide range of facilities open. There is no requirement to determine need. And what we may end up with is, and I'll use Center County as a great example. If any of you have been here, you know that we have a large medical center, Mount Nittany Medical Center. And we also have tremendous services here from Geisinger. Geisinger basically offers anything here except they do not have a hospital. So we are looking at having Penn Highlands Healthcare, which is out of Du Bois, open up a micro hospital, which is scheduled to be open June 1st. And so the question is, what is the need in the community for that? And I'm not saying that there is or is not a good a good need for it. But it is a way, I think, to really look at competition for market share and trying to see how the inroads in a particular health system can be made in a community. So we have a couple of newish hospital types. One is the micro hospital. That is a facility that is owned by a larger health system. It does not have its own operating number, EIN, and it is can have a maximum of 10 beds. It offers a whole range of primary care and ancillary services. And that is what we are going to be seeing here in State College when the Penn Highlands State College facility opens. We also have something called an outpatient emergency department. That is a new type of facility that is it's for an existing facility that for whom it makes sense to downsize. They eliminate all of their inpatient beds. They have to have a full service emergency department. They must have triage and transfer agreements in place with another larger facility. And they provide essentially the ancillary services that are required when someone comes to an emergency department. We have one OED in Pennsylvania, and that is UPMC Lock Haven, which is in Lock Haven, Pennsylvania. There's a new type of facility called a rural emergency hospital that CMS put in place a year ago in January. And the outpatient emergency department here in Pennsylvania is built very much on the rural emergency hospital designation. We have been working with the Department of Health and the Hospital and Health System Association of Pennsylvania since November of 2022 to try and get the REH established here in the state. We actually have the National Technical Assistance Center for REH designation located here in the state. That's the Pennsylvania Rural Health Redesign Center. And so we're working very hard trying to get that established here. But essentially what we're looking at is if you build it, they will come, not to borrow from Kevin Costner. But the other thing that we are seeing here in the state is a significant consolidation of health systems. And I'm sure that you have seen that. We have UPMC and Geisinger, Penn Highlands, Penn Medicine, Conemaugh, the health system that Penn State is part of. So we are seeing this significant market share across the state and competition. So when we're talking about looking at rural versus urban communities, one of the areas that we think about, or one of the metrics that we use, is something called the Area Deprivation Index, or ADI. And if the ADI takes into consideration factors such as income, education, employment, and housing quality, which for those of you who work in public health or think about social determinants of health, those are 4 of the main areas that are included in SDOH. And through looking at these metrics, there's an index that is created for every area across a state. And here is Pennsylvania's ADI. As you can see, these are the rural communities up here. I don't have a pointer. I'm not quite that sophisticated. But when we talk about rural Pennsylvania and in looking at the map that Kyle put up, we have what's called either depending upon who you're talking to, we have either the rural T going across the northern tier and coming down through the central part of the state, or what's probably more accurate, the rural J going across the northern tier, coming down through the central part of the state, and then curling up underneath Allegheny County where Pittsburgh is located. We also have rural areas over here. So as you can see, the darker red spot in the state becomes, the more it is disadvantaged. And for the most part, all of those disadvantaged areas are up here in the northern tier, down here where we have Fayette and Union counties, and over here in this part of the state, And then way down here in Philadelphia, as I'm sure you know, if you look at all 67 counties in the state, the most rural and the most urban very often mirror themselves. And that is certainly the case with Philadelphia. They always come out number 67 when you're looking at health status indicators. Here we have healthcare facilities across the state. Again, this was prepared by the Center for Rural Pennsylvania. We have several counties in Pennsylvania where we have no hospital, and those are in the red circles. As of May 1st, we will add a county to that when when Penn Highlands Elk in St. Mary's closes their labor and delivery unit, but they don't appear on the list yet because they're still open. But we do have what are called 16 critical access hospitals, meaning that they're very small, very rural. They serve high Medicare and Medicaid populations. And we also have, right now it says 68 rural health clinics here. It's actually 69, but sometimes it's a little hard to keep track of rural health clinics because they tend to open and close rather quickly, and CMS and our office can't really keep track. I wanted to talk, we could talk about rural healthcare across the lifespan, but I want to start on talking about rural maternity care. So we're going to talk about at the beginning of the lifespan, and after this, we're going to talk about healthcare at the end of the lifespan. And then I'll tie all of this together in terms of what it means for local economies. So rural maternity care is essentially the most expensive service that a hospital can provide because of these fixed costs, such as medical malpractice insurance and needing to have an OBGYN and an anesthesiologist and nursing staff on site 24/7. And so what we're seeing is, and this is one of the issues that Penn Highlands Elk has referred to, is that they are very challenged to be able to bring in the appropriate level of staffing. And they have one OBGYN in the community, and he's overwhelmed. And they are having some real challenges being able to bring a new one in. So essentially, if you are a hospital, you need about 200 births annually to cover costs. And in rural communities, the volume for delivery does not reach that level. If you are in a larger facility and you have a higher number of births per year, even if it is not at that 200 birth level, you have the economies of scale through larger numbers of commercial insurers and so on, where you can offset some of those costs. So in rural, we are looking at a high reliance on Medicaid payments and also uninsured patients. If you look at any state budget, but if you look at Pennsylvania's, you will see that the Medicare line item is the highest of any line item in the entire state. So what we think about in terms of looking at maternal care in rural communities where there is no OBGYN available and pregnant persons are getting their care through, let's say, their primary care physician, who of course is very qualified, but perhaps not trained quite as much in the OBGYN space, or perhaps in the kinds of complications that can arise during a pregnancy, there do become some concerns about quality of care. But we also are talking about the continuity of care, where we have the care that occurs prior to pregnancy, the care during the first, second, and third trimester, then delivery, and then what we call the fourth trimester, which is the time after the pregnant person and the infant have gone home. Is there a way that they should be getting support for a month, 6 months, a year, to help them, their infant, and their family adjust to having a newborn in the house? So when we think about maternity care in rural Pennsylvania, we're seeing a 14% decrease in the number of birthing hospitals, and we also have maternity care deserts. So right now, we have 5 maternity care deserts. They are all, for the most part, in the north central part of the state, but Elk County is going to be added on to that. And this is from some work done through the March of Dimes. I can tell you that one of the interesting pieces that has just come out that I heard on NPR is that there was a study done by Boston University and Pitt, where they were looking at changes in permanent decision-making for childbearing, given the changes that have been taking place across the country in terms of reproductive care. And that what they are seeing, and I have to pick up my piece of paper here because it just came out, is that between tubal ligations and mastectomies, they are seeing an increase of 85 total per 100,000 population, where young people, and Kyle talked about this during his slides, are choosing either to delay having starting a family, or are choosing to not start a family at all. Now, Pennsylvania is a little immune to that because our state has not made major changes to reproductive health, which could potentially lead to individuals who want to have a strong maternal health system come into the state. But I think it's a little soon to make those decisions. Oops. Again, another great map from the Center for Rural Pennsylvania, looking at hospitals with staffed obstetric and OBGYN beds by rural and urban. And as you can see, if you look here along the southern tier against Maryland and way over here in New York, we have no beds whatsoever. If we are here, let's say we're in Elk County, and this is closing May 1st, sure, pregnant persons, when they go into labor, can drive down. My cursor doesn't want to work. Can drive down to Jefferson County, where Penn Highlands Du Bois is located. But I don't know if any of you have driven on any of those roads. Route 219 is to the west, and then Route 255 is to the east. And those roads are terrific when it's July and there's no snow and there's no fog. It also is great if you are a family that has childcare services close by and someone to come in and take care of your kids. And if you have a car that is roadworthy and can make it down. So there are lots and lots of nuances in terms of being able to access maternal care. And so now let's talk about rural long-term care, which according to Kyle, I'll probably need here in the next month or so. But when we look at Pennsylvania overall, 72,000 Pennsylvanians are living in the state's 689 nursing homes. We have about 144 nursing homes in rural communities. And while elderly and persons with disabilities account for about 30% of the total Medicaid population, as you can see, we have 78% of Medicaid expenditures going toward these individuals. So if I'm sure that many of you have studied Medicare policy, you know that if an older person is discharged from the hospital after an inpatient stay, not for observation, but for inpatient, if they are discharged to a skilled nursing facility, Medicare will pay for the first 100 days of that care. After that, it either becomes private pay, which can be up to between $8,000 and $10,000 a month easily, or that person, if they are able, if they have spent down or they're able to demonstrate that they are eligible for Medicare, for Medicaid, they become what are called dual eligibles. Now, Medicaid does reimburse at $250 a day for nursing home care. And as you can see in the chart over here, $252 is about the average cost for a nursing home. But the important piece that I want to bring up is that CMS has put out proposed rules looking at skilled nursing facility staffing ratios and have set essentially a new bar for that. And what we have heard across the state and across the country is that not that we don't in any way think that nursing home residents don't deserve as much care as they can get. I had a grandmother in a nursing home for 10 years and was there every other weekend to make sure that she got the care that she needed. But it is so expensive to bring in charge nurses and also to bring in nursing assistants. And the turnover is very high. So we have the potential that if and when these staffing requirements go into place, we may in fact be looking at nursing homes that are closing. And as a quick example, over in Mercer County, just in the last couple of weeks, 3 nursing homes have been sold to a for-profit organization. And here we have nursing homes all across Pennsylvania. And you can see where we have essentially a lack of them coming down through along the rural T and then the rural J. So again, these are some of the labor issues that we have been seeing. So what we are seeing is that 55% of skilled nursing facilities are turning residents away. We know of one nursing home right now that has 17 residents in their skilled nursing facility, and they are going to have to close that facility. So they are looking for places for those residents to go. And I was reading an article where one of the researchers was talking to a nursing home resident, and she said, "Honey, do you know where I'm going? And where are they taking me?" Those are really hard questions, I think, for not only nursing home staff to consider, but also for the residents and also for their families. And in this one nursing home that we are looking at, it is in essentially the most geographically isolated community in Pennsylvania. And these residents will need to be moved to at least 20 miles away, if not farther. So let's connect the dots now between the rural economy and rural health. So what we hear across Pennsylvania and what we hear across the country is that when facilities close, whether it's a hospital or it's a nursing home, what we hear from residents is basically, we're unimportant and our community does not matter. Now, Pennsylvania has been essentially fairly immune from the hospital closures that have taken place across the country, although we do see that we have had hospitals that closed. Sunbury, I'm thinking of, was one that closed recently. But we are also seeing potentially looking at changes in the types of services that hospitals are offering, or maybe decreasing or trying to offset some of those costs with looking at some other kinds of affiliations. We don't want to have residents removed from their communities, and we do not want to have a lack of healthcare services in there for both existing and new benefits. And when in looking at community and economic development, when a business is considering moving into a rural community or is already there and considering whether or not they should expand, what are some of the first things that they look for, right? What are the school districts like? What are the communities like? What are housing costs? What is the safety in the community? But also, where will not only our employees, but their families get the health care that they need? This became very evident when fracking suddenly exploded across the state, across the northern tier and down in southwestern Pennsylvania, where the drilling companies wanted to make sure that they had emergency departments close by in case of poisoning or any kind of other injury. And when we look at this, we see if healthcare is reduced in a community, we see not only the loss of that particular job, but it is estimated that healthcare expenditures roll over about 4 up to 7 times in any community as employees take those dollars and they reinvest them in other goods and services. We may also see job losses in other sectors. And as Kyle was saying, if we're looking at lower per capita, we're looking at a lower tax rate, which means an overall loss of revenue for other services. So I have all my references here. I do want to say this is a topic that looking at healthcare delivery, healthcare services, and what it means to have that that section of that segment of the anchor community and anchor economy change is something that is receiving, fortunately, a lot of discussion at this point. So I will stop talking there and take any questions.
Thanks, Lisa. Thanks. Kyle, if we have any questions for our speakers, you can just simply unmute yourself and
Please do. And let me also ask another question of you all while you're thinking of questions to stump us. We are so very generously invited each year to give a talk during this seminar series. And, you know, Kyle and I have lots of things that we think are tremendously fascinating because this is all we think about is rural. But what would you all like to know about? What would make it important to you all?
Hi, I have a question.
Sure.
All right, about some of the terms you used, like ADI, the Area Deprivation Index. Are these terms commonly used at like all state rural departments, or is this like specific to the agency in Pennsylvania? Are these concepts
Well,
we see in other states?
this is a national index.
Okay, thank
And
you.
so we're using it here in Pennsylvania, and I am certain that other states are using it in one way or another, maybe not out of state government, but the researchers and others across states.
All right, thank you so much. I'm from another rural state, a different rural state, so I
Oh.
really enjoyed your talk. Thank you.
Sure. What rural state are you from?
I don't live there right now, but I'm from Maine,
Oh, okay.
and I've got very elderly family members, and I've seen a lot of the issues you're talking about in both Maine and New Hampshire, where I have family members. So
Yes.
I really enjoyed this talk. Thank you so much.
You're so welcome. Thank you.
Lisa, there's a question in the chat. It
I
says,
see.
do you have any numbers on predicted nursing shortages in
Pennsylvania? You know, I don't. I just wrote that down. So I'll go out and check. I think I can answer that question, but I would be making it up for the most part, and I don't want to do that. So I'll send the information off to you all.
Kelly has her hand raised. Kelly, just simply unmute yourself. And
Great. Lisa and Kyle, thank you so much for your presentation. I thought it was a really great source of information and really interesting to see the challenges that Pennsylvania is going to face now and especially in the coming decades. So one of this might be an overly specific question, but so I know there's some part of one of the proposed Penn State strategies to deal with Commonwealth campus enrollment declining is to focus more on, to have kind of the campuses focus more on a particular specialty. I think I read somewhere that like one of them would kind of be more focused on nursing. And so I'm curious about if you see this as a viable strategy to addressing the loss of healthcare like staff in these areas, and then if there are larger strategies that are being discussed or that you think could combat the effects of population aging and the negative impact on the economy.
Kyle, do you mind if I jump in?
Please go ahead.
There are two things happening across Pennsylvania. One is that the governor's policy office has taken a very keen interest in rural Pennsylvania. And back in January, they convened a Rural Hospital Sustainability Summit roundtable. And that's going to be meeting over the year. And we're also going to be looking at workforce. And Governor Shapiro came to the roundtable and was quite eloquent in what he understood to be the issues in access to healthcare services in rural areas. And he said, and I quote, "So get to work, come back to me with a plan by the end of the year with a budget attached." So there's a lot of rather frantic activity going on around that. So there could, and I don't know what the answers to all of that will be, because fortunately it's only April, we're not in November yet. So, but the other is that Penn State, especially since Dr. Karen Kim has come as the Dean of the College of Medicine, there's now been, thankfully, a renewed interest in rural and what Penn State is doing related to rural health, but also other rural initiatives. So that is just starting as well. That started in January, and the Commonwealth campuses are absolutely on the list of that. And I can tell you that after all of the money, all of the programs, all of the initiatives that have been launched and paid out in the last 30 years on recruitment and retention, the number one predictor of whether someone will practice in a rural or other medically underserved area is if they come from that community or another community like that. And just on Friday, I was having a conversation with someone who runs a foundation in a rural county, and at his previous position, they had created a community-based fund to bring in physicians. They focused mostly on physicians who came within their specific geographic area because they found that that significantly increased recruitment and retention. So I think that especially as far as nursing is concerned, considering all of the resources that are available at the Commonwealth campuses, that to me, it seems almost like a no-brainer to be able to think about those as real hubs for that kind of training. That's a really long-winded answer to your question.
No, that's fantastic. Thank you so much. And I'll be sure to keep an eye on what's going on with the School of Medicine initiatives as well.
Thank you. Are there any questions for our speakers?
Anything that you would like to hear from us next year, if we should be fortunate enough to be invited back?
The invitation part, I'm sure we can handle.
Okay, well, let us know what you'd like to hear. I'm not sure, we could talk on something else, but I don't know if we'd know anything about it. So,
All right. If there's no other questions for you. Thank you very much, Lisa, as well as Kyle, for taking time and for the fabulous presentation.
all right, thank you so much. And the slides are available and they will be sent out. I think I'm going to send you a new set of slides though, because I made two small changes to them today.
Absolutely. Yeah. All right.
All right.
Sounds good.
Well,
I'll wait for you.
Thank you to
right,
both
thanks,
of
everyone.
you. Wonderful presentations.
All right, thank you both. Bye now.
Take
Bye.
care.
Bye.
Bye.